question a lot about trans feminine people and whether or not they should go through menopause, essentially. So for cisgender women, average age of menopause is about 51. They can go through it much earlier, even, early 30s in some cases, but usually it starts, they start somewhere in their 40s having symptoms, and then by the time they're around, they're 50, 51, early 50s, that's usually completed, and it's called, ovarian failure, meaning that the ovaries are no longer putting out as much estrogen as they used to, and so essentially they are reliant upon the estrogen that is produced and the testosterone that's produced from the adrenal glands as the main sources for their sex hormones. And this is generally going to be a much lower amount of hormones that are put out than what they're used to. And so this is when you start seeing cisgender women of that age start complaining of, being tired, having no energy, having no libido, and such things like that. So I get asked, should trans women go through menopause? I believe, whether you're cis or trans, that forcing someone to go through menopause is pretty terrible. I can't imagine telling someone that, yeah, you get to be miserable from now on. You get to feel like a slug. Even in cisgender medicine, when folks are treating cisgender women for menopause, sometimes it's difficult for those women to find people who will treat them and prescribe for them, because historically healthcare providers have been very terrified of estrogen in cisgender women because of, breast cancer risk and, cardiovascular stuff and whatever that had been published in much older studies. There are better studies nowadays that show, much more positive data that this can, number one, improve quality of life, like 100%, like much better quality of life. And that it can be actually protective in many ways to receive either estrogen or testosterone supplementation for these cisgender women. It's not the danger that it was seen in the past, I guess, is what I'm trying to get across here. But healthcare is slow to change. If anyone is very familiar with trying to get healthcare providers to change their ways, you will know it is very difficult. Back to trans feminine people. So when trans feminine people are coming up into that same age range, or, if I see someone who is already in that age range and I have started them on hormone therapy, what do I do? So generally speaking, once someone has been on good quality hormone therapy for anywhere between 4 to 7 years, and they consider themselves, cooked, so to speak, they've reached the maximum potential probably for physical changes to have occurred at this point. And so what do I do after that when they are of an age that's, say, over 50 years old? Do I recommend, decreasing them down to, quote, menopause levels like what cisgender women would have? Personally, I do not. I have a discussion with my patients about this, because some of them actually want this for whatever reason they want to have it, either because they want the full experience that cisgender women go through, and so they want to feel that they are experiencing hormones authentically as if they had been assigned female at birth. That's perfectly fine. That's their decision. They can change their mind at any time. Perfectly fine. But essentially what I do is I treat them as if they would be a cisgender female who would come to me for hormone therapy, and and they are just getting treated for whatever symptoms they're having. And so generally speaking, for any age group, I would say we would have a discussion 5 to 7 years into their hormone therapy to say, okay, do we need to, should we reduce it slightly? Because, I mean, you don't need puberty hormone levels for your entire life. You know, that does have an element of, you know, you're getting more than you probably need to maintain your features and how you feel and all that. And so if you're getting more hormones than you need, is this then a risk? And in some cases, yes, it could be a risk for blood clots or other cardiovascular effects or things like that. And so when you've gone through that initial puberty, again, you know, about 5 to 7 years or so, generally I would probably recommend a slight reduction in your dosage to bring you more in line with what your normal age group would be. Not the menopause age group, but like, you know, for example, myself, I'm in my early 40s. My estrogen levels are not going to be anywhere near what they were when I was like 18. And so I would say, you know, maybe bring them more in line with that if you are that age as well. If you're 40, you know, you don't necessarily need to proceed forward with an 18-year-old's estrogen levels forever and always. If you've hit that point in transition where reasonably you're not going to expect any more transitional changes and you're just maintaining at that point is what I'm meaning, then I would recommend probably anywhere from 15 to 30% dose reduction ish. And then of course that's also with the person's comfort level, what's their overall health, what are their risk factors, how do they feel, you know, on the new dose and all, you know, yada yada. It's a process. It's not something that I tell people you have to do this because, you know, cookie cutter medicine or whatever. It's a process, and it's, you know, a discussion on this subject. So anyway, I don't recommend personally that trans women go through menopause. I think that's miserable. I think it's miserable if people make cisgender women just sit through menopause when we could easily help them have a better quality of life by just giving them enough hormones to feel like a person again. So anyway, so that is my opinion, and take it or leave it. But I get asked this all the time, and so I figured I would go ahead and make a video about that. So anywho, full dose ahead for those in the middle of their actual like physical transitioning, and then whenever you have cooked and you've reached the end of expected physical feature changes, I'd say go down more to a maintenance dose, which, like I said, 15 to 30% dose reduction depending on the person, and da-da-da-da-da. And then whenever you are in that age range for menopause, so to speak, it's a discussion on, you know, what do you want? We can carry on with the maintenance dosing, perfectly fine by me. Or if someone wants to go through menopause, they're also more than welcome. I will tailor the dosage down to create that effect. So anyway, hope this was enlightening and helpful for someone out there. See you later. Bye.